Hello and welcome to our interview. My name is Marianne Kannengießer, and here today is my dear colleague, Dr. Sudarsana from India. And my dear colleague, would you please introduce yourself to our community? And then we start to talk about homeopathy in pediatrics.
Welcome, Dr. Maria. I am myself Dr. Sudarsana, practicing in Tamil Nadu, Madurai, India. I am a lecturer working in Government Homeopathic Medical College. I have completed my PG and I hold an additional degree in Clinical Psychology. I've been into the field of homeopathy for the past 19 years and I have a great passion in treating children. I'm experienced with many sort of cases and I enjoy thoroughly homeopathy.
So how did you meet homeopathy? How did homeopathy come into your life?
Actually, my dream was to pursue medicine, that is to join MBBS. So I was working hard for that. And my father was, he was an engineer, he was an IM graduate, he was taking homeopathic treatment from a physician and he was interested more into homeopathy. Actually, I couldn't secure a seat because of the entrance marks got a bit reduced in my MBBS admission. And my father, he just suggested me to take on homeopathy. It was how I got into homeopathy. So it was only because of my father's insistence and guidance that I entered into homeopathy, and gradually I developed a liking, and today I cannot go. This homeopathy is my whole world, I can say.
Yes. So it happened as in many of our colleagues, you just fell in love with homeopathy. Now tell me, in which part of India are you working?
I'm working in South India, in a state called Tamil Nadu.
Okay, in South India.
Down South India, Chennai. You can connect Chennai.
Yeah.
It's down south to that. So I'm placed in South Tamil Nadu. It's a place called Madurai. It's famous for Meenakshi Amman temple. A temple, all temples, it's quite famous. And I work as a lecturer in the Homeopathic Medical College, Government Homeopathic Medical College here.
Okay.
For the past 19 years.
So you are in a region that is attached to homeopathy. Is this correct?
Yes.
As far as I learned, that region has more homeopaths than the other regions in India. Is this correct?
Kerala and West Bengal has more homeopaths when compared to Tamil Nadu. I could say it's comparatively less than Kerala and West Bengal. But homeopathy is, people are aware here. More number of practitioners are here. People are aware of homeopathy. And after COVID-19, more people are aware of it.
Okay, and what amount of population is usually treated with homeopathy in your region?
It may be around 20%, 20 to 30% of the population.
This is exceptional, because in Europe we don't have that. You are blessed, your Indian homeopaths, I think.
Thank you. And we are closely allied with traditional system, not closely allied, the traditional system of medicine called Siddha and Ayurveda, which is native to India. They also are equally in par with this power of homeopathy, and everybody has a chance to treat. So we have a nice role, better than all, and we stand next to allopathy, and more people taking homeopathy willingly here.
And yes. And you have this ministry of Ayush, which we all lack.
and hope so in the future it will come here. So,
Yes, I hope so that in time and with all these interviews and that I can show the world that we can have what India has and that we can step up in Europe.
yeah, sure. I hope to.
Yeah. So tell me about your cases of, oh, my phone just making a mess here. Sorry about that. Um, so tell me about your interest in pediatrics and maybe some of your interesting cases in pediatrics.
As I had already mentioned to you, I was initially focused with female special OP, right? Female special OP means all the gynec cases, mostly the
Mm-hmm.
gynec cases. And whenever females come to the hospital, they come along with their kids if it is a holiday. And they will automatically, if there is a minor cold or a minor flu or something like that, they'll get the child treated in the OPD. This is with regard to the government sector I'm talking. So simultaneously, a female who carries a child with her not only seek treatment for her alone, but she'll seek treatment for her child also, because she cares a lot for the child. So obviously it will be like treating an entire family. Okay,
Mm-hmm.
so once a female comes as a patient to us, we'll treat the entire family. So it came like that. Then I got shifted to the pediatric special OP. One thing is that pediatric special OP is, pediatric cases, with regard to the pediatric cases, if I need to talk that, we have to observe a lot, and we have to have a lot of observation. But I think it is the symptoms what we get from the child, it clinches you the remedy very easily rather than an adult taking an adult case. So it is like giving a voluntary rope to the medicine, a voluntary path to the medicine, and the child. And how I got more involved in pediatrics is that once a child is very much relieved of the symptoms, they'll be more friendly of nature. They'll be a friendly of nature. They'll be coming out and greeting you as soon as you come out of your, as soon as you enter the OPD, they, even if they're standing in the queue, they'll be rushing out of the queue and coming and greet you there. They'll be wishing you there, and they'll be seeking your presence. That will be the kind of attachment you will find in treating a pediatric case, which you may not get in treating an adult case for that.
Yeah.
I'm not sure about that. That is the kind of thing. If a child likes a particular person, definitely they'll be attached to them. The clinginess you'll find in case of a pediatric dealing with a pediatric case. And to talk about some of my most interesting pediatric cases, one is with a spastic type of cerebral palsy. A
Mm.
spastic type of cerebral palsy. She was referred from our allopathic counterpart. She was already into physiotherapy. And the thing is that she cannot use her right arm. And the child was an obstinate, but at the same time shy child. She was an obstinate and shy child, and she would be just not hiding behind her mother, but she'll be clinging to her mother every time she visits the OPD, and she'll not be talking much. About the age of 6. Okay, she's about the age of 6 years. She'll not be talking much, but she'll be very neatly dressed, and she'll come as a very pretty child to the clinic. She'll not be talking much, but she'll be very keenly observing whatever I talk to the mother and whatever I inquire from her mother about her. She'll be very keenly watching. She was a she uses only the left hand because of the spastic type. She could not use her right hand, and she was using the left hand for everything. So, in an Indian culture, we are compelled or supposed to use the right hand for everything, because the children will be compelled to use the right hand to eating, to seek something, to get something from somebody. We have to use the right hand, but the child is not using the right hand. So, the mother was very much worried. She comes from a rural background. So she was very much worried that my child is not using the right hand, and people are just humiliating her because she is not using her right hand. So such was her thing. But the child was not worried about that. She was not a bit worried about using her left hand, and she resisted to physiotherapy for quite a long time. So we have been taking a case like this, and we opted to choose, and I opted to choose Silisha for this pretty child, and because of obstinate nature, and she was very curious and an obstinate child. But if she is assigned with a task, she will perform it with regard to her any other activity. Any other activity, she has got a good IQ. Everything other things was perfect, and in a duration of about 6 months or so, she could develop that pincer grasp. The pincer grasp we could find in her right hand. She was gradually turning to use the spasticity or the rigidity of the right hand was gradually getting relieved, and she was able
Wow.
to start activities with her right hand. This was one of my interesting cases. And one more acute case we could talk of acute cases with regard to mesenteric lymphadenitis. So a boy aged about I think 7 years. Okay, he was having a very sharp pain. He was having a very sharp pain in his region of the right lower half of the abdomen. That is, we commonly doubted to be an acute appendicitis. That was the region of his pain. We would think them he is to be suffering from acute appendicitis. Only thing he did, he just had vomiting also. He had vomiting. The area was tender. On palpation, I found out that area was tender, but he was not febrile. He was afebrile. So I just gave at the moment Belladonna 1 m water dose, and I asked him to return. We asked him to return to the OPD in the afternoon after taking it in water doses. I asked him to return in the afternoon and advised him to take an ultrasonogram also. So this was the initial setup, and he came back morning by 11 o'clock. He was attending the OPD. He got the medicine Belladonna 1 m, and he came back at 4 o'clock saying that I got my pain relieved within half an hour of taking this medicine. And he came with the ultrasonogram also. After his pain got healed, he went and took an ultrasonogram, and he came back with a report stating that it was his mesenteric lymph that was got enlarged, and it mimics that of acute appendicitis. Thereupon we started taking all his conditions. We started with arsenic amalgam after that. The drug was chosen was arsenic amalgam. And he didn't have another episode of this acute colic thereafter. From his start with belladonna 1 m, and after he was started with arsenic amalgam, he never had arsenic amalgam 200, a dose that was repeated every week. Every week he had one dose for 1 month continuously. And after that, we did with only Rubra. We did with placebo. And he was taken a repeat sonogram after 6 months, and he was totally relieved of this complaint, mesenteric lymphadenitis. His abdomen was quite free. And nowadays I could find a lot of why I was talking about this mesenteric lymphadenitis is that in our OPD for the past 2 or 3 years, I've been seeing number of cases of mesenteric lymphadenitis, and a few of the cases got all right with tuberculinum also. Few of the cases they got all right with tuberculinum also. So I think this is on the rise. The cases of mesenteric lymphadenitis presenting by between the age group of 5 to 10 years, it is on the rise now. It is increasing right now. So I just wanted to disclose that maybe because of the vaccination BCG effect. So we are seeing cases of mesenteric lymphadenitis right now on the rise. Maybe it may be linked to that, and tuberculinum holds good for that condition. So that is, I wanted to share this idea to
This
the
is
people.
very interesting. So this sharp pain could be connected to just insult from vaccination.
Yeah, yeah.
Which kind of vaccination?
Which kind of vaccination? Maybe BCG. I hope it is after BCG, because most of them they stop. They do not follow the entire 10-year course. They just give stop with BCG and finally with polio. I could relate only this thing with BCG because tuberculosis, the vaccine for tuberculosis, because it spreads, because it is connecting to the lymph node again. It affects the mesenteric lymph node, so I could connect this with the vaccine for tuberculosis. So
Extremely interesting to me as a vet because of, you know, this kind of pain happens a lot in horses. And horses are overdosed in vaccines in reality. So thank
reality,
you for
but
that.
yeah, sure. Welcome, welcome, welcome.
And one thing that is interesting, it's as a vet, we have the same problem. We depend on observation.
Yeah.
We depend on the
And it is
observation of,
more observation rather than us, rather than a child. Vet is only on observation, I hope.
and this is a similar thing that you have to observe quite closely, and then you can rely on the mother a bit.
Yes, yes.
Yes, and
Not a bit, majority. You can rely entirely sometimes on the mother's words if it is an infant.
did you see any disease conditions passed on from the mother to the child?
Mother to the child. I have seen case of vitiligo. To remember, I don't know. Actually, we don't study like vitiligo as a familial condition or something like that. But I've seen few cases of vitiligo where the mother has a few random spots here and there. This hypopigmented patches getting here and there, and the child getting affected profoundly, much more than the mother.
Mm-hmm.
That is one thing. Another one, I could say, if there is an emotional suppression or some not emotional suppression, if there is any, if the pregnancy time uh, was uh, was seen with most emotional setbacks or some kind of turmoil in their family, the child has a lot of skin complaints, skin ailments. I could relate to the emotional disturbances in the mother. And there is hyperkeratosis, that is on the foot, cracks in the foot, hyperkeratosis, and eczema cases, which have got treated with carcinosin. That was one nice case which I got treated with carcinosin, and
Interesting.
that was one case which I could not forget. And one vitiligo case, which I had always like what to say, one vitiligo case which we used to have an idea about vitiligo that arsenicum sulflavin is the specific for vitiligo, and I had used in many cases and I had not found any good results with regard to vitiligo cases. And so I gradually I understood that we have to go on to, in the beginning of my practice, I thought ASA was the only remedy for vitiligo. But as I started giving more and more patients with the AS arsenic sulfuric, I understood that it is not going to work. So better take a constitutional approach. So that has been the mode of treatment. And if I could say one specific drug for vitiligo which would act very nicely is selenium. Selenium is a very nice remedy which is actually suggested by one of my senior colleagues, and I had been using right now it for my pediatric cases. Nowadays, more and more pediatric cases with vitiligo or eczema we see. Not only nowadays, it has been in vogue for a long time. But selenium is more effective in reducing this pigmentation. We know that selenium is a micronutrient, so maybe this potentized selenium may have a larger role to play in case of skin ailments, I suppose. And I could say completely that selenium is a very great remedy in treating vitiligo cases, and I have found it to be very successful rather than going for fixing it as an self-flavor. I could suggest selenium as a wonderful drug for treating vitiligo, but it is more of constitutional where you have to take entirely the history of the individual and understand what is the emotional role that is playing in his development of that particular ailment, and prescribe an prescribe a constitutional drug for that. And this is what I have experienced with regard to a transmission through a mother. This skin, mostly it has landed up in skin or respiratory complaints. And it is, one thing is carcinosin. I remember treating the case with carcinosin. And selenium, it has been for quite a lot of cases getting improved with selenium. I can assure you that selenium plays a very vital role in the treatment of vitiligo.
Very interesting. Do you think that selenium might be connected to the rise of the prescription of selenium? Might be connected to our toxic environment?
Maybe like we could relate it that further researches, if we are having it on that particular line, we can have an answer to that. I connect it like that because we are seeing more number of cases like vitiligo. It's like when I was in my years of study, when I was doing my UG, I could not see these many number of cases vitiligo in pediatrics. Maybe in adults we could say, but nowadays it is right in the beginning, the tender age of 5 years, or to say 7 or 10 years, these kind of skin complaints, you could say, maybe to the toxic environment plays a role in this, we could say.
In your area, do they take a lot of glyphosate?
I'm not able
Roundup?
to get you. What, doctor?
Some kind of toxic thing for treating plants. Glyphosate is the
No,
ingredient.
not this. No, though it is not a farming area, not something like that.
Okay.
Maybe because of the biologically modified food, fortified items, or maybe the fertilizers that they use to grow plants, vegetables. That may be the reason.
Maybe. Okay. I was just thinking in farmers' terms. Okay, so another question I have is, here in Europe we have rising amounts of children suffering from ADD or autism. How is this in India?
It is also on the rise globally, competing globally. Everything is on the rise, beating global standards in the occurrence of diseases. It is equally heartbreaking to see more and more individuals, more and more children with autism and ADHD. I can say that why these children are, I feel for them, really feel for them, why these children are deprived of their natural childhood. They have to, they, not only them, but it is also the parents who bear the brunt of it. They have to be entirely at the side of the child always, to make them achieve academically, to make them progress, to make them social. They have to be at them at their hooks always to bring about their child. And autism needs a continuous assessment, and Barataka, it holds very nicely, and it is a continuous process. We cannot put a full stop that your treatment for autism is over by now. I cannot say anything like that. We have to continuously assess the individual right from the comfort consultation till they go on to 17 years or something like that. It is that process. With ADHD also the same way. it is purely constitutional treatment that would go with the treatment of autism or with ADHD. And I always opt for occupational therapy along with the treatment of autism or ADHD, because it is not only by nature we can bring about anything. They have to be nurtured a lot. They have to be nurtured a lot, and this nurture, it has to be continuously given to these individuals, the children suffering with autism and ADHD. And it is the number of cases, number of persons or children with autism and ADHD, it is ever increasing. More and more number of children are diagnosed with autism. It may be mild, moderate, or severe, but there is a lot of children that are getting diagnosed with autism and ADHD. We cannot rule out their prevalence right here, right now. Homeopathy offers a promise to that. They can make they make their lives better, but along with the additional therapies.
Yes, yes. I always said these are special brains with a special task. What do you think? Why do we have this increase of ADD and autism?
It's the cause may be manifold. One of these is we are using the environment or exploiting the environment at a very faster pace than we are supposed to. And nature's playing with our genes. That is what I can say. So the answer is we are exploiting our resources at a very faster pace than normally the earth could not replenish by itself naturally. So at a pace where if we are supposed to use only 10% for one particular year, we are utilizing by more than 50% in a year. And all the electronic devices, everything, the waste we accumulate in the earth, the radiation exposure, everything adds to the uh, increase in the occurrence of these kind of cases. It is we who are the cause for this condition. Nothing more. We cannot blame God, we cannot blame anybody else. Our practices.
Do you think this is just something from the divine to say to mankind, don't go further that way, don't go further that track?
Yes, I truly say that. I would truly agree with your statement, Doctor, that it is a testing time. It is a testing time that is given by the Almighty. Okay, put a full stop to everything, whatever you've been doing right now, bad to Mother Earth. Start it fresh again, so that your children, future children, will be born with good brain, good arms, and good legs. Save Earth. It is what? It is a test from the Almighty.
Could easily be. We have to definitely seriously think about that. So another question I wanted to ask you was about the legs that we have in homeopathy, leg caninum, leg maternum. Do you use those very often in children?
Lactanum, yes. Lactanum quite often in case of children. I have used both lactanum as well as lactochlorotin. Not quite often, I could say, but yeah, I have used. I cannot say that I've used quite frequently, like 1 in 2 cases or 1 in 3 cases, but it has been used. Milk remedies have been used altogether. The most common would be the remedies that are being used in children will be the antisodic, great antisodic sulfur. Uh, that has been of use in many cases altogether in correcting their miasmatic block. In addition to that, we can hold the calcarea pause, calcarea carb. These were the remedies that were most often used. Apart from that, I could say that many tarantula and with regard to lack remedies, if there is incoordination, there is a sense of flying or some kind of the attitude disturbance, memory, defective memory, it was used. And for 2 or 3 cases, I do remember having used laccanine in particular. And it was followed with sulfur. Intercurrent was sulfur for that. So it got completed like that. There's remedy chosen, and we always have an anti-miasmatic remedy in the metal as an intercurrent, and then it will be followed. It goes like that.
Okay. So, what was your experience with COVID-19 and children?
A great pandemic descended on us. The experience here, right here in India and Tamil Nadu, concerning myself is we are involved in preventive aspects. Right. Arsenic album 30C has been suggested by the Ministry of Ayush and it has been used full-fledged. It has been distributed all over the state here. Every nook and corner of Tamil Nadu, every nook and corner of India, you can say it is available everywhere. Everywhere, the government is giving arsenic amalgam, and a lot of surveys are going ahead with that. And I'm also assigned. I mean, our college is also assigned with COVID care center duties. So apart from arsenic amalgam, to mild and moderate cases, uh, I had prescribed, like I was prescribing bryonia for viral pneumonia, and it was very good in relieving the dry cough as well as ticta
Mhm.
pulmonaria. Both bryonia as well as ticta pulmonaria were entirely good in relieving the cough, and 2 cases with mild breathlessness where SpO2 fall was 60. That was good with, but they didn't get admitted in their hospital. They were hospitalized. 60 was admitted in the hospital. They were taking aspirosperma, so they were taking aspirosperma along with. So bryonia was holding a major role in treating cases once it turned into symptomatic. Both arsenic amalgam was preventive as well as prophylactic, so they could arsenic amalgam plays a crucial role along with bryonia. So we have started. Both the government sector and the private sector, both are involved right now in giving an integrated approach in the treatment of COVID-19 patients.
Very
So this
good.
is what is happening in India right now.
This is great. The rest of the world still lags then. Did you do the homeoprophylaxis with arsenicum album C30 with the children too?
Yes, sure. A lot of children, and till now we have not got anybody turning COVID-19 positive, even though they are in the environment. Their neighbor or somebody in the same house who had not taken arsenic amalgam, they got infected. But right till now, by God's grace, arsenic amalgam 30 consumed from here has not reported positive for COVID-19.
So great. I just cannot see why Europe doesn't copy that.
But I could say that even if it is much, if we are given much more opportunity rather than this of youth, is that all over, if in the entire country, if homeopathy is given more chances of treating mild and moderate cases, at least it will not proceed to the more severe ones. We are seeking for a much better chance than this. We are only given limited options, so we are praying for more opportunities to treat more number of COVID patients so that they don't proceed on to severe.
Yeah.
I would like, can I ask you, doctor, any vet experience which you could share with me so that I can carry back with me?
Oh, bad experiences. I had a lot. I didn't have my office for a long time, only for 10 years. I got a heart attack aged 35. And after that, and I nearly died. I passed over to the other side and did see and hear a lot of things. And after that, I did retire a bit and went on the long spiritual journey to see what I met in that heart attack. So I can only talk about those 10 years of homeopathy I had. And one very interesting case was a cat with a virus disease specific for cats, which damages the eye. The cats have tearing eyes, the cornea is inflamed, the blue thing in the eye gets inflamed. And in that cat, one eye had total inflammation, panophthalmic, and was, you couldn't see an eye anymore. It was just a blue reddish ball. And taking all the symptoms of that cat, I finally decided, because it's a long time passed on in that village with this disease for cats, I decided for syphilinum. And I actually gave 1M because it was either he makes it or the eye had to be taken out. And short after that syphilinum, the eye stopped discharging, and it took him about 4 weeks to restitute the eye. He got sulfur after the syphilinum. Sulfur was his constitutional remedy, I would say. And the only thing that stayed back was anterior semihia of the iris. That was a pinpoint with the cornea, but the eye restituted nearly totally. That was an amazing case too.
Very nice, very interesting to hear from you, doctor.
Yes, that case wouldn't have been possible with conventional medicine. Absolutely impossible. Another case I remember was a dog, a boxer dog, having an acute pancreas inflammation with bloody vomiting and bloody stools and losing strength and power rapidly. So I got him on the, how do you call it in English? When you have the needle in the vein and you give external fluid?
Okay, intravenous.
Intravenous infusions, yes. And I gave him phosphorus C30. In that case, I did the injections of phosphorus C30 because he couldn't take anything per mouth. And I gave it hourly, and that dog recovered within a day.
Wow, it was fantastic.
And then he stopped with the bleeding and reacted very, very well. And obviously, this phosphorus was not only the acute remedy, but was the constitutional remedy too. And he later on got onto LM potencies, Q potencies for the rest of his life and was well ever since.
Very nice.
Another nice case I remember. And if you're interested in one case more, I can tell you about a horse.
Yeah, sure. Most welcome, doctor.
Being bitten by ticks and getting borreliosis. Do you know what this is? It's a bacterial disease transported by ticks.
Okay.
Which is very damaging. It's a bacteria getting into the blood and going for the kidney and the liver and the whole system. And you can even die from it if it goes very bad. And that horse was totally allergic to antibiotics, because usually you would go for antibiotics, doxycycline, and would give it 3 weeks, and then the horse would be cured. But in this horse, this was no possibility. That horse, I started with Arsenicum album, and it's a long time ago. I don't really remember, but it was 4 remedies in the succession, and in the end, it was a Kalium iodatum. And he got off all his symptoms. He had severe edema in the feet, severe edema in the scrotum. It took him 4 weeks to pass the disease without any help of conventional medicine, only homeopathy, and he never had a setback. He was a therapeutic horse, doing therapy, riding therapy with children. Was a very expensive horse, so they tried everything. And this, in this case, I had the same experience as you have with the children. Whenever that horse did see me, it would just jump at me and come and cuddling me. And be cuddled by a horse is a very difficult thing. He would even take me for a ride. He was so happy to see me.
Okay, they shower all their love and affection.
Yeah.
It was very nice.
And now the latest case, but I didn't treat it. One of your Indian colleagues did treat a cat of mine with it had bladder stones.
Okay.
And the bladder stones couldn't be treated properly or early enough, so we had to go for surgery. And after the surgery, which has been very, very invasive surgery, he was treated with arnica and staphysagria, and now we are going for his constitutional remedy, and he's recovering extraordinarily well.
That's fantastic.
Yeah. I cannot praise enough the miracles of homeopathy.
No words to describe the miracles.
And for myself, I had the most miraculous healing with arnica. I did break my ankle, and it got very swollen very quick. And the interesting thing was that I wanted warmth on it, nothing cold.
Okay.
Very interesting. So I was given arnica that time from a colleague. Arnica 50,000. And the swelling got away within 2 days. We only did taping, no cast, and I was driving my car after 3 days.
That's great. That's the miracle of homeopathy.
That's the miracle of homeopathy. It's unbelievable. So, what is your advice for mothers thinking of their children?
Yeah. Actually, the care of the child starts from the womb. That is when they are pregnant. The care of the child starts when the child is in their uterus. So they should have a hale and healthy lifestyle starting right from their pregnancy, mentally as well as physically, sound, healthy lifestyle. And they should take, if at all they have any complaints during pregnancy, gentle medicine is homeopathy. So it will blossom their child into a healthy child without any faulty trends getting transferred. So it is better to start taking homeo medicines right even during their pregnant state if they have any ailments during their state. And after birth, a child should have a healthy environment. A healthy environment, by the way, I mean the family. The family as a whole, it is a healthy environment. The very near environment is the family. So the family should be very healthy. Healthy in the mean that they should have good, sound relationship, a trustworthy family where they have a secure bonding to the child, and the child should be taught, not taught. It could be said that guided with all the values and virtues that they could adopt in life for a healthy lifestyle. Uh, that is what I can suggest to protect themselves, to protect Earth, and to serve as a good child to Mother Earth. That is what they can pass on to the next generation.
This is what a lot of your colleagues say, and the more I hear it, the more I think we all have to do a driving license. Why don't we have to do a parent license?
Yeah, sure. You a nice idea. Only if we become eligible to be a parent, not just getting married and giving birth to a child is parenthood. We should be prepared. Our mind should be prepared to receive the child and to bring up the child in the with the right sense, a moral responsibility.
Yeah. And as you said, it starts in pregnancy, and at least there you have 7 months time to prepare, to get everything into a good place instead of hormonal and emotional turmoil, which will end up in very bad results for the child. And it was very interesting to hear from you that the emotional turmoil in the mother might result in skin disorder for the child.
That is that is uh, that is a great topic, and it needs. I think it needs a separate session if it is to be done. The turmoil, the emotional turmoil during conception, during pregnancy, that relates to so many illnesses. That is skin complaints, that is suppression of emotions leading to skin complaints. That we see in our day-to-day practice more of.
Do you think that the lockdown and all the restrictions we had will create a global new trauma? Maybe as a
Definitely,
miasm?
yes. As a miasm, yes. This is a state of mind because we are restricted to something. We are confined to a small environment. Man is a social animal. He has to mingle with so many people in his lifetime, but we are confined to four walls inside our house. We are restricted. We are not able to go outside to meet our colleagues, to meet our friends, or even to our office. We're just working off from our home, and and this could be seen as a major change in the psychological aspect, because, and especially in childhood, this could be taken as a severe trauma to the psychological development, because the social behavior is totally obscure and it is lost because of this lockdown. And the child, if it is brought within closed doors, it will not know how to behave with its peers. The child will not know how to behave with a friend of his, or how to behave with an elderly person, or how to meet strangers, how to behave in presence of strangers, or whatever it may be. The social behavior is completely traumatized because of this lockdown, and it is definitely having to going to have a major impact of the kids of this generation. Maybe some adults could cope up, because already stress has been a part of their life of adults, and majority of them could, I say that majority of them could cope up, but there are adults who move into depression, and we have seen instances of people committing suicide. A lot of suicidal incidences have come up because of this lockdown, because no people to vent out what they feel, what they could feel. They could not share it with anybody. Even though we have a lot of social media or a lot of this electronic gadget in our hand to talk with people, but everybody is engaged in their own world, and the communication is totally we even though we have more sorts of communicable modes available, the person to person interaction is totally deprived. And for a sound mind and body, the person to person interaction is very much essential, and that is totally lost because of this lockdown. And it will definitely have an impact on the life of everybody. And children, of course, to the child.
When I heard you talking, it reminded me of bird remedies.
What are the 4 remedies that got you?
Hmm?
I'm not able to get you, doctor.
It reminded me on the bird remedies.
Bird remedies, yeah.
When I heard you talking about being encaged.
Yes, feeling of caged. It is as if being in a cage.
Yeah.
That's it. We are actually in that caged mode.
Mm-hmm. We will see whether we will have Falco cases or not. Falco peregrinos could be.
Maybe in the future we may have we may be in need of those remedies.
Yeah.
It could be.
We will see. So one last word from you,
Okay.
which is important. Some topic we did not cover.
Some topic I don't. I have covered the entire thing, I suppose. With regard to pediatrics, we have covered. Apart from that, I was talking about female diseases, nothing more. Uh, and again, I could say that I see more number of PCOD cases and infertility, PCOD, infertility. It has been landing like a cycle. Uh, Earlier days, it was the myoma of uterus in the late adulthood, or in the adulthood period, it was just myomas and hysterectomy being done for that. That was the more number of cases in the initial stages of my practice, like some in the initial first 10 years of my practice. But for the past 6 or 7 years, I had been seeing an increase in polycystic ovarian disease and a rise in the case of infertility, both male as well as female. And male infertility is on the rise. It exceeds, it is equal, it is equally competing. And a lot of oligospermia, azoospermia cases we meet nowadays, and more females are suffering from more young females right from their teenage. They're having issues with regard to this polycystic ovarian disease. It may be either amenorrhea or it may be menorrhagia. It can be either way. And homeopathy definitely offers a promise to all these individuals, but it is a very, what is that? The, the treatment with regard to this PCOD is very tough struggle between the physician and the patient.
Yeah.
Because we start for amenorrhea, we'll end up with menorrhagia. It goes on like that. Then we have to control it. It goes on. This harvest like this and that. So it is somewhat more complicated than the pediatric case. Treating of females suffering from both menorrhagia and amenorrhea, that is the symptom of PCOD, is really challenging.
Yes,
And
I think so.
it is okay. It goes well with homeopathy, and we have to tackle the anemic state also along with that because of this prolonged menorrhagia that is getting accompanied. We have to tackle the anemic state also, and sometimes we have to resort to intravenous infusion of plasma for that. So
Yeah.
it's all like that. It is a tough management with regard to PCOD. Severe stubborn cases of PCOD, it's very tough to be managed, but it is quite successful, and females are quite happy that they don't get addicted to regesterone. They'll be frequently given regesterone over there, and the females who are taking homeopathy treatment, they'll feel happy that they have no kind of addiction, and it is safely landing them to their normal menstrual cycle. That is what
Oh,
we
that's
can
great.
assure them of.
That's great. So the advice for any mother or any woman wanting to be a mother is definitely to consult a homeopath.
Yeah, if I were to advise to the mothers, if they're having a female or a male, what a female child means, uh, resort to naturally indigenously available foodstuff, I mean vegetables and fruits that is available in their particular region, so that they are not subjected to more uh, pesticides or the cold storage effects, so that it will not interfere with the hormone. Normal endocrine activity will not be affected. And that is one suggestion or advice I could give it to the mothers. And resort to homeopathic medicines to correct if at all they have any complaints with regard to their menstrual cycle. And advice to the mothers would be that if it is a teenage mother, to talk freely with their children, to make their children to be more accommodating with them, talk to their children as a friend, as a guide, who could listen, to have a very patient ear to their children. That is what is needed. And observe their children frequently, to, because children of teenage parents, they have a very what is that, it's like a tough fight having a storm in your house. That is what I could say, experiencing a daily storm in their houses, rearing a teenager, bringing up a teenager in your home. So they should be patient enough to bring up a teenager, to understand. Most of the teenagers, they'll not tell what are they suffering from also, because they feel very shy to visit a doctor, or they think that their image will be tarnished if they go and visit a doctor. So they'll not be, uh, 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 they not have a welcome idea to visit a physician for their complaints. So the mothers should observe what their child is actually suffering from, if at all they have any trouble with regard to their health, be it either a male or a female child. So mothers play a crucial role everywhere.
Women and especially mothers play a
Yeah,
crucial role.
for sure.
And yes, if we don't go for taking things back to normal
Yeah.
and be serious about that, mankind could fail.
Yes. Every woman is the backbone of humanity. I mean, if I'm right, we could say that if if a mother or a woman is leading the, she corrects the family, she's able to bring up a healthy family, a healthy environment, a healthy country, a healthy earth. That is what we can see. So she forms the backbone of everything.
Yeah, that's a good last word. We stop here.
Yeah, fine, doctor. That was very nice session.
Thank you very much for the interview.